Just to give you an idea of what the OARs require for a licensed detox facility, the minimum staffing ratio is listed here. So as we expand the number of beds, we also have to expand our medical team.
Substance detox is a difficult thing to do, especially on your own. And that's why the ARC's Detox program always has a list of people who want help going through the process. Fortunately, despite the COVID-19 pandemic reducing the detox program's already limited capacity, the ARC is currently seeking funding to increase their capacity by more than twofold.
So as I said, I would start with just a general definition of our detox program. We're defined by the American Society of Addiction Medicine, or ASAM. We're modeled after level 3.7, which is medically monitored inpatient treatment as it's defined under ASAM. It is the highest intensity service before hospitalization. It's for patients in an inpatient setting who are at risk for withdrawal from substances or have medical needs that require careful observation, treatment, or follow-up. We provide 24-hour medical oversight by a team of licensed practical nurses, typically 2 per shift, oversight by registered nurses. And then we also provide care oversight by a licensed medical provider who meets with every patient within 24 hours or sooner based on acuity. We also provide therapeutic and educational services, and those are typically delivered by a certified alcohol and drug counselor and a certified recovery mentor or peer support specialist. I mentioned that we're co-located with our community sobering program, which we staff. Sobering is really a 24-hour drop-in sobering unit. Unlike detox, it's an involuntary program. It's a public safety and jail diversion program as opposed to a treatment program. So our primary customers really in this scenario are law enforcement and public safety or the community. Sobering has also been impacted by COVID because of the configuration of the building. So our locked sobering rooms, we have 4. However, one of those has historically been a cooperative male room. So up to 5 cooperative males can go into that room. During COVID, we went down to 1 person per room, which unfortunately cut our capacity in half down to 4. So back to our detox program, we are technically licensed for 12 beds. Due to the capacity constraints in our current location, we can only operate at 10. And to complicate matters more, we actually staff at a level where we could have 16. Unfortunately, as with so many other programs, we did have to reduce during COVID. Essentially, with some fluctuation here and there, we've been at 6 beds. And then we have experienced occasional workforce shortages due to the pandemic. So there's been some fluctuation here and there. So as you'll see here in this matrix, in 2019, we served 393 distinct patients. In 2021, we served 282, so over 100-person reduction. In 2019, we had 489 enrollments. In 2021, we had 335. We primarily in our detox facility treat alcohol use disorder, opiate use disorder with some exceptions. That didn't change very much because their percentages between 2019 and 2021. So our average length of stay hasn't changed very much. It was about 5.5 days. But of course, the number of bed days we could provide went down. And there's something interesting here as well, which is our utilization. Because we believe it's low, we know that the demand is out there. And so we're always striving for our utilization to be higher. In 2021, we had 864 entries, and that's not distinct clients because people will move on and off our wait list. Of those entries, 330 turned into an enrollment. And our average wait for people on that wait list is 15.8 days. So messaging around wait list also can be really hard because we don't want anybody to ever feel like there isn't hope. So what we like to tell people is that we often see people get in within the week because we do.
As you heard from Danni, we can't fit any more than 10 beds into our current location. And just to give you an idea of what the OARs require for a licensed detox facility, the minimum staffing ratio is listed here. And so in addition, so as we expand the number of beds, we also have to expand our medical team. We're also required to have therapeutic services provided by a CADC and a CRM or a PSF. We are in the process of seeking funding to support a remodel of an existing ARC property to accommodate 16 to 24 beds to serve different patient populations in 3 to 4 separate pods. And so when we say pods, what we mean is the facility is designed for the purpose and to be able to continue to operate during an outbreak of infectious disease. So that has a lot of implications, but we want to be able to isolate by individual and also by pod if needed. We want to accommodate 16 detox beds, 4 endocarditis step-down beds from the hospitals, and 4 flex beds that would allow us to do step down, respite, or detox, depending on what's needed at the time.
Well, again, I'm so grateful that you were able to put this together. And I think, knowing that there is a full continuum of services, and it could be fuller, as you've shown with your desire to grow, but that there are all these different interventions and supports. And it was kind of said at the end there, Danni, but the fact that your CRM engagement team is there also helps lessen the sting on the wait list. I mean, if they can have different supports and engagement while they're still waiting, I think that's a huge change. And I know that's been a more recent addition to your service array. So very cool to hear and see.
Thanks, Eric.